My job as a skills facilitator involves looking after the medical students mainly while they're on placement here within the orthopaedic department. Because we are a teaching hospital, we're extremely lucky. We have 3 education centres within the department, and everybody is willing to do teaching. It is part of their role, so it does provide a better career path really, and there are also lots of training courses available to everybody. Within trauma orthopaedics, we're very lucky. We've got a 60-bedded trauma unit at the minute, but we are looking forward to be going to a major trauma unit, which will be a 12-bedded unit for major trauma patients, which gives nurses more opportunity to specialise within trauma, giving them more skills to develop their career. There is so many opportunities between nursing. You can start off wherever, either in medicine or surgery, and you can develop your career in whichever pathway you want to take. I just like the idea of the caring role, caring profession, and working with different people and patients, and hopefully the idea of getting people, making them better really. It depends what's right for you, isn't it? If you want a career, caring for somebody, looking after people, making people better and making a difference, nursing's a career really for them to take.
I got into nursing quite late. I was 35 when I started my training at UCLan. So I'd had my children, and I decided I'd always wanted to be a nurse, and I nursed my father who had bowel cancer in 2000 and decided that I wanted to give back and deliver that patient care with good quality and feeling, because I'm quite a caring person, a bit soft but caring, and that's what really got me into nursing. I'd had my children and I really wanted to go into a career, so I decided in 2005 to go into nursing. There were students on the cohort that I was in 2005 that were older than myself, and we all had an equal footing. You were given all the opportunities that you wanted to do. You weren't classed as a mature student, you were just a student nurse. So it didn't matter whether you were 18 or 48, you were all classed as the same, which I thought was really nice. And we all supported one another, because some of the older students supported the younger ones, and the younger ones helped the older students because they were used to essay writing, where us older ones weren't so used to it. But yeah, it was very good. We were given very good support. I think what I love personally in critical care is because we nurse either have 2 patients to one nurse or one-on-one nursing care, you can deliver a whole holistic picture to that patient. Because you've got that time. We are busy in here, and it is what we call intensive care, because it does get intense, but we have the time. We are with that patient, and that they're the centre of your world for that shift. So you can meet all their needs as best possible, and I love that. And I love seeing a patient when they arrive on critical care, they're so poorly, and then maybe 2-3 weeks down the road, they're sat up in bed having a cup of tea, and you think, we were part of that. And that's what I love about nursing in critical care. Obviously we do see a downside, but the positives are, you know, a vast majority of our patients do get better and do get transferred onto an ordinary ward from being in here. I'm trying to get my daughter currently at the moment to do her nurse training, because I think she'd be very good. I would say, first of all, it's not an easy career. You have to be, it is a vocation. It's not something you think, oh, I'll have a try at that. You have to really want to do it, and you have to really want to care, because it's not easy. It can be stressful at times, but on the flip side of that, it's so rewarding. You can deliver really good quality care, and you can see patients getting better, and you've been part of that. You've helped that patient along the way. You've supported them, you've supported the family, and time again we do get cards that come into the unit to say thank you for the care that we've delivered. So I would say nursing is an excellent career. It's the best job I've ever had. The hardest job I've ever had, but it's an excellent career, and it can take you wherever you wish in the world. Once you've got your qualification, you could go wherever you wish in the world with that British nursing career, and you can take to Australia or America or anywhere you wish to go. And I've only been nursing since 2005, which is only 10 years, and 3 of those included my training, which isn't very long really, but I am now classed as a senior band 5, and I am now looking to do what we call the critical care degree course, which will enable me then, if jobs come available, to apply for a band 6 sister post, and that's where I hopefully see my career path going, staying within critical care and progressing to a band 6. The management here in critical care are very supportive of the staff. If you have a problem, you go to them from the onset and they support you through that, no matter what it is, because I've had problems myself while being here, and I've had really good support from the management team in critical care.
Well, my role specifically specialises, I'm a surgical nurse, so I'm ward-based, and I work with the consultants and the doctors and the theatre staff and the HCAs and the full multidisciplinary team, the occupational therapists and the physios. But I specifically, my role the part I play is I prepare my patients for theatre. I do a theatre checklist and get them all ready, relieve any questions, and then we liaise with the anaesthetist, the consultant, explain again exactly what's happening today, relieve any anxieties, and then they go off to theatre, and then I recover them. So they come back to me post-operatively, and we go through the rehabilitation process together, combined with the physios and the OTs, and we cover a range of surgery as well, urology, breast, ENT, upper GI. So we're very, very established in the areas that we work in, and that's again quite unique for me because it keeps me, I like a challenging work day, and learning, every day is a learning day as well. So my area is, I specialise in breast cancer. So for me, my interest lied with breast cancer itself, the disease, and giving them a better quality of life and taking that cancer away, if not taking it away, treating them for that, and that applies to any surgical intervention. So for me, it was the rehabilitation process of them coming in, supporting them, guiding them and aiding them through that journey, and them coming out and having a better quality of life, if you will. At Preston, you've got your major trauma. Here, you've got your specialist breast cancer unit that creates amazing opportunities for any area that you want to do, surgical and medicine. The team here and at Preston are, and have helped me throughout my career, are a great team who create opportunities for you and help you develop. If you're willing to take a risk and try it, nursing for me is, I feel very lucky to fall. And the look on someone's face when you come into work and smiling, and you're their first point of contact really, and without the family, and when all of that's taken away, you're there for them to create a professional relationship.
Working in theatres is really interesting. You get to see all the operations, and you get to learn different things and new skills. I really enjoy it. I love things like the operations and stuff, and I watch things like that on TV. So just to watch that, at first I was quite a bit daunted, but yeah, I really like it. Well, if you're interested in this side of things with this job, and operations or anything like that, and you can learn and improve in your new skills, I would recommend it. The best part, well, because I recently just come back from maternity, they've been really flexible with me anyway, so my hours now and the days of work, they're really good with that, with the childcare. They do put you first.
I've always liked working with people, and it's the fact that you can do something to help someone and to make their life better that made me want to become a nurse. I currently work in an outpatient department. It's fracture clinic, which is orthopaedics, so it's looking after anything from babies to 90-year-olds who have either broken bones or have an orthopaedic condition, and we basically see them in clinic. We may see them in the treatment room after surgery to check on the wounds and dressings, that sort of thing really. If you're a people's person and you enjoy being with people and talking to different people, and you have good people skills, that's a good basis for being a nurse. You have to be a caring person, and you have to have that nurturing within you really to make a nurse. And you may not even have the best education, but if you have those basic skills, it's a good basis for a good nurse. Just working with different people every day. In an outpatient department, it's not the same as on a ward. On a ward, you can have the same patients for a few days, but in an outpatient department, you have different patients every day, and it's just the variety of people that you see. And you make what you want of your career. You can come in as a staff nurse and stay as a staff nurse for the rest of your life, and you don't have to progress if you don't want to. But they do encourage professional development as a staff nurse. So I personally have done my degree since qualifying, which opens new doors for progression and moving up the bands. There's not particularly much in the outpatient department, but if I wanted, personally, I would like to have a role in education. So that would be my way to progress for myself.
Qualified in 2000, was successful in my first staff nurse's post on Ward 10, upstairs on general surgery. Worked there for a couple of years, and then I went travelling for about 8 months to Australia. Did some nursing out in Australia, and then came back, and I've been here, as I say, 8 years now as a band 6, which is a sister working on the unit. Love my job. Love my job. There's never a dull day in ICU. Never. You see so many different specialities in one day, because we don't just, we're a neurotrauma centre, but we're the trauma centre now for this area, so we get so much more trauma remit through it's really interesting, lots of different things, so it keeps my mind. There's never time to be complacent. You're always learning, and I find that refreshing. One aspect of my job that I really enjoy, which I'm getting more and more involved in, is the teaching and supporting of junior staff, and I get involved in some of the study days that the trust are involved with the trauma and the AIMS course. So it's a good place to come after you've got a little bit of experience from a ward. It's a good place to come to sort of really broaden your knowledge, and then you could maybe decide on what area you'd fancy sort of specialising in. I'd strongly suggest people come down. Don't be frightened to come and visit. If it's an area they're thinking of come in your own, if you can come in your own time, spend a couple of days just seeing what it's all about. But definitely get some ward experience, and ICU it opens it up. It's well supported, it's always well staffed, so you won't be left in the deep end at all, and it will open up a lot of opportunities.
I've always been interested in operations. I find them so exciting, especially joint replacements and that type of operation, which I spend most of my time on orthopaedics. It's just the skills unbelievable, and it's very interesting. And I'm usually as close to the operation as I am to you now. And it's good. Yeah, but you're mostly concentrating on the scrub nurse and make sure they've got all the correct instruments, and if they're doing joint revisions, you need to be aware of what they're going to need and anticipate what instruments you're going to need for that operation, so you need to be on the ball with it. It takes your mind off the operation, but it's just good to watch. It's a fantastic NHS to work for. It's very caring. The staff you work with are great. It's I'm really enjoying it. To see people coming in for an operation, and then follow them through to recovery, and then you see them a couple of days later, and you bump into them and they're up and walking about, and it's quite amazing really, because you know what they've gone through. I mean, they don't see anything. They've got a curtain in front of them, and that's quite amazing.
You're looking after either 1 or 2 patients, so you get to know them, you get to know the family, you're looking after the family as well, supporting them, supporting their emotional needs. It's different every day. So one day you could be looking after a trauma patient with multiple injuries, chest injuries, head injuries, and then the next day you could be looking after a post-op patient and just following them through on the enhanced recovery pathway and preparing them for discharge up to the ward. I would recommend nursing, yeah. There's many career options, there's many different paths you can go down, whether you wanted to work in day case, do hospital work out in the community. There's lots of different things. It's a career you've got for life and you can take anywhere. And it's very rewarding, very rewarding.
Yes, well, there's a lot of evidence now that outcomes for major operative procedures in a variety of different specialties are much better if carried out in a major high volume centre rather than in small hospitals. So with this in mind, over the past few years, quite a large centralisation progress has been occurring nationally as well as locally, with centralisation of vascular services with the ultimate aim of improving outcomes for vascular surgery. And over the last 3 or 4 years, we have undergone a bidding process within the North West. All hospitals were asked to submit bids to become a major vascular intervention centre. And the idea is that vascular surgery in the future will be carried out in a smaller number but of large centres rather than small hospitals. It's really exciting because it's a major opportunity for us to develop into a very modern, state-of-the-art vascular service. We were fortunately successful in our bid to have the Lancashire Teaching Hospitals site as one of the major intervention centres for Lancashire and Cumbria. And we're very, very pleased at that. It's a great opportunity. Yes, well, it's important because we will be serving a population of 1.5 million taking in patients from Wigan, Blackpool and Morecambe Bay. So with that population, we will have 10 consultant surgeons and hopefully 10 interventional radiologists. So the scope for doing all sorts of major arterial interventions, even the more complex procedures, is enormous because the expertise with that number of consultants and staff, the expertise is there to really participate in quite a lot of major complex procedures which in a smaller centre would not be possible. A hybrid operating theatre, which I'm pleased to say we are having a brand new hybrid theatre built as we speak on this site. A hybrid theatre is an operating theatre with facilities for very complex interventional radiology. And there's complex radiological equipment there which allows us to do the combined procedures which involve surgery and interventional radiology. And most of the developments which are occurring in vascular surgery at the moment are related to improvements in the technology to allow more and more endovascular procedures to be undertaken. This has the potential to be one of the biggest vascular centres in the country, actually, with serving a population of 1.5 million and a 10 consultant manpower. I can't recollect any other vascular unit which is certainly any bigger than that, and very few have got that size and serving that degree of population. So I think it's really exciting. It will be at the forefront, I'm very sure of that. Yeah.